Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is what you need to know about facet joint syndrome. Facet joints are these joints that are about the size of a thumbnail on either side of the spine, all the way from the neck down to the sacrum. Okay? They do contain cartilage just like other mobile joints, the hip, the knee. Together they allow each individual an impressive range of motion of the spine. But even though they're very small, if they're arthritic, they can be a tremendous source of pain. So facet joint arthritis does not start in the facet joint. It actually starts in the disc in the front of the spine. Okay? Normally you have a lot of water, you have a lot of height, kind of like this. As it degenerates, it starts to lose water, it starts to get compressed, it can bulge out like a tire that's getting flat. And it shifts stress to the back of the spine, such as you see here. These joints kind of look ratty in appearance. They have some overgrowth of bone. The red indicates inflammation. Okay, so it really starts in the disc and moves to the back of the spine. Why is facet arthritis more complicated than that of the hip or the knee? Well, there really is no effective facet joint replacement like you have in the hip or the knee. There are two facet joints at every spinal level, and usually several are affected. You only have two knees, you only have two hips, but you have over 40 facet joints. And even though each joint is very small, in and of itself it can produce a significant amount of pain. Why do people develop facet syndrome, i.e. arthritis? Most commonly it's from degenerative wear and tear, known as osteoarthritis, over time as we age. Post-traumatic degeneration can occur, might be subsequent to a whiplash. Genetics, there is a component, we just don't understand it very well. How is the problem definitively diagnosed? Well, to start with, the history and physical exam can be helpful. X-rays can be suggestive, but they don't correlate. You can have a really bad looking X-ray but no pain at all. Okay? Interventional procedures are not just therapeutic, they can also be diagnostic. So here you have a needle going in and injecting numbing medicine around the joint, not necessarily in it, although you can do that. That's a facet injection. But this is a medial branch block, and you inject the numbing medicine and it numbs up these little nerve endings called medial branches that supply sensation to the joint. If that provides relief, you can sit back, the pain doctor can sit back and say, aha, that's the joint that's causing you the pain. But you know what? That in and of itself can give 3 months on average of pain relief. So medial branch blocks are great. So what other treatments are available? Well, over-the-counter medications like anti-inflammatories and Tylenol. Opiate medications, typically short-term. Long-term opiates are not a great idea for spinal arthritis. Pain management creams, prescription creams or patches can be great. Physical therapy and chiropractic treatment, TENS units, and spinal decompression therapy. You can see that here. It's actually computerized intermittent traction that helps pull spinal levels apart and can provide pain relief in over 80% of patients for months at a time. Interventional treatments, we discussed medial branch blocks, but let me show you something. This is a nerve root coming out, okay? We're not talking about that. We're talking about these little nerve endings called the medial branches that come off of the nerve root to supply sensation to the facet joint. No motor, just sensation. So they come up and they also come down from the above level. So when you do a medial branch block, you actually inject in two places. One to get the lower area and two to get the higher area. And that can get pain relief in and of itself for about 3 months. A facet intra-articular injection actually puts the needle into the joint, just like you would a hip or a knee, and steroid medication is injected. Here you can see that, the needle going into the joint. For radiofrequency ablation, if a facet injection or medial branch blocks works well and then wears off, a radiofrequency ablation involves applying thermal energy to this area to deaden those medial branches, and that can provide pain relief anywhere from 6 months to 18 months. It's been a revolutionary treatment for back or neck pain. The typical outcome of treatment, here's some statistics. Medial branch block, 85% effectiveness for 3 to 4 months. Radiofrequency, 80% excellent results for between 6 and 18 months. And then another study showed that you can actually repeat that and expect the same results. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome. The top non-operative pain management is with the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. Success rates average over 90% with the board-certified award-winning doctors. Visit us online today at texaspainnetwork.net And then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.